What's up, everybody? Welcome back to another episode of the Dude Nurse Show. Today, I wanted to talk about something that's very near and dear to my heart, as I love the profession of nursing. Year after year, for the last 25 years or so, nurses are consistently regarded as the most trusted profession. I think the only year that we lost out was in 2001 due to 9/11. I think the firefighters got us that year. Regardless, nursing is a highly trusted profession, and it's one that, you know, pays well. You have job security, good. There's good benefits to it, and honestly, you can really do with it what you want. You can go off and get advanced degrees. You can become a nurse practitioner, which is what I chose to do. You can go the leadership route, which I've done some of that as well. I also have an MBA. I don't particularly care for the leadership, but I've done it nonetheless. The field is wide open, you know. So what I want to talk about is, why are so many nurses leaving the field, especially those that are doing direct patient care, or as we say, at the bedside. And also, why are fewer people coming into the profession of nursing? I did a segment a couple of months ago about a hospital closing in Eugene, Oregon, that I went up there to assist with, and I found an article, or an interview rather, from a lady who was president of some nursing organization, and she was adamant that there is no nursing shortage, and she couldn't be, that could not be further from the truth. As I said, there's some staggering statistics as to the fact that there are nurses leaving the profession. Let me look some up for you real quick. But before I do that, there's a couple of key elements to this problem, and we'll talk about that kind of individually. But let's take a look at that. Let's see here. Here's an article. This was done on March 24th, 2022, and it was done by Healthcare IT News. And it stated that 90% of nurses considering leaving the profession in the next year. 90%. I mean, that's not 9%, 90. So that's almost all the nurses in the field are considering leaving. Now, granted, that's 90% of whatever sample size they had, you know. So if they did 100,000 interviewed 100,000 nurses, 90,000 of them were considering leaving in the next year. That doesn't mean that of all the millions of nurses we have, you know, 90% of every single nurse, but still, that statistic is staggering. And some of the reasons for that are burnout is a huge one, staffing shortages, and this was even prior to COVID. You know, I mean, COVID was unprecedented. You know, whether you believe it or not, you think it was some conspiracy. The hospitals were nonetheless overran with people with illnesses, and, you know, as nurses we had to take care of them. But prior to the pandemic, there's been a shortage of nurses. In fact, Years ago, there was this big push of bringing nurses over from the Philippines. Worked with a ton of Filipino nurses, amazing nurses. Then after that, I started seeing a big push of nurses coming from Africa, particularly Nigeria, coming over. Also, amazing nurses. And I mean, and that's not just the U.S. There's other countries that, you know, kind of roll out the red carpet for nurses. There's a shortage of nurses all around the world. Nurses make up the largest workforce within healthcare. So, you know, there's more nurses than doctors, than techs, nurses' aides, etc. There's more nurses than any other part. There's also this pervasive nature of, and you guys, anybody who's ever worked in healthcare, or especially as a nurse, you've heard it, you know, nurses eat their young. And that is something that is just absolutely despicable. Many people view it as kind of a rite of passage, you know, baptism by fire, if you will, or, oh, you know, I had to go through it, so therefore you must go through it. And it's absolute crap. That kind of segues into what one study called lateral violence, which that was a term I had never heard. And I'm going to read another statistic from another study. This is from the Online Journal of Nursing. It says, nursing has been considered the primary occupation at risk for lateral violence. Studies estimate that 44 to 85% of nurses are victims of lateral violence. Up to 93% of nurses report witnessing lateral violence in the workplace. 93% report witnessing it. That's huge. I mean, like ridiculous numbers. And you know, in these studies, what they find is that the newer nurse or the novice nurse is the most likely individual to be a victim of this lateral violence. And again, that kind of ties into the nurses eating their young kind of a thing. There's been cases where, let's say you have a nurse who's a brand new charge nurse, and you know, say, you know, they work at a hospital, say they're the night shift charge nurse, and they do some things, and then the day shift charge nurse comes on. Well, the day shift charge nurse maybe has been doing it for, you know, however long, and they find all these things wrong with what the night shift charge nurse is doing, rather than trying to assist that newer nurse, because they're likely going to know. You know, there's usually reports sent out. You know, they meet at shift change. It would be unusual for them not to know that this person is new in the position, or you know, maybe they're a newer nurse. This is their first you know, kind of leadership role. Really, charge nurse isn't really leadership, but so you know, regardless, it's you have a little bit more authority and autonomy than if you're just, you know, a bedside nurse. So rather than telling this nurse, you know, hey, there's a couple of things that, you know, I'd like to go over with you, you know, we can do it at shift change, you know, whatever. Sending them a note, an email, or just telling them when they do the shift change. What do? No. They send a message to the unit manager or the unit director or the facility director and say, oh, this person's doing this, and this wrong. And they still offer no help. They don't offer any solutions and say, you know, hey, I think he or she needs to be retrained on ABC. They don't do that. They just want to throw them under the bus, and they come to the leadership team with problems, not solutions. When I was in leadership, I would tell my people, hey, don't bring your problems to me. Come to me with some things you're having issues with, but I want to hear some suggestions that you have to fix it. Because, you know, that's not my job. I'm not a genie. You know, you don't just, you know, come in and expect, you know, I wave a magic wand and it gets fixed. But I think a lot of people expect that from their leadership, and that's kind of another problem. We'll talk about that in a minute. But when there's these issues, there's just a notion to just throw these people under the bus just to make them look bad. And I think it's absolutely horrible. I remember when I was in nursing school, I've been a nurse now for a dozen years, and I can still remember walking onto the units, and my instructor would be there with us. She had to be there with us in the hospital, and she would walk on the unit and say, I'm Dr. So-and-so. All of my instructors were PhDs, nurse practitioners, amazing instructors. And they'd show up and say, you know, I'm Dr. So-and-so with the University of Texas School of Nursing. I have some students today. And you would just inevitably hear this, oh, and you would just hear these groans, and it just, there'd be 5 or 6 of us standing there, and we just kind of look at each other like, what the fuck are we, you act like that, you know, you just told these people that we're infected with smallpox. Like, what the hell? And I was actually lucky in the fact that I'm a male. I remember the nurses, primarily female, would say, you know, I'll take him. And they would tell me, you know, well, you're going to have less drama, you know, and they would say other things that I'm like, wow, that's really horrible, but great for me. I always had great preceptors. In fact, I still have a pair of trauma shears that when I did my emergency room rotation, my preceptor, her name was Rebecca, I'll never forget her. She bought me a pair of trauma shears because I did my high acuity rotation in my 4th semester, which was my final semester of nursing school. And I was like a couple of weeks from graduating, and she gave it to me as a graduation present, and I thought that was just so sweet. But I remember my cohorts, because we would meet at the end of our shifts every day, and we would discuss our patient cases and talk about the care plans, and we would have to write care plans and do med lists and all kinds of stuff, and then turn that in. But like I said, we would discuss it in a conference room or something like that. And I remember so many times that my fellow students, female students, would come in and they would just be bawling in tears. And I'm like, oh my God, did your patient die? I mean, did you, what happened, you know? And they were just like, my preceptors were so mean to me. They just treated me like garbage. And I'm just like, wow. And as I got on in my career, you know, I saw it when I would start a new job or I'd go to a new place. They'd pair me with somebody, and they would, before they even introduce themselves, they'd be like, look, I don't like teaching people, you know, I don't want to be here, I'm having a bad day, whatever. That was their introduction. And I'm like, okay, this is going to be great. This is going to foster learning. You know, it makes you not want to ask questions, and you're just like, okay, I don't want to piss this person off, you know, I'm the new guy, you know, who's going to believe me if I go and report a problem versus this nurse who's been here for 5 years or 10 or whatever, and when they clearly need to be the hell out the front door because they've lost all their compassion. You know, it's not okay to treat people like that, and that is part of what is driving would-be nurses away and current nurses, keeping them from wanting to go on and continue providing care. Another side to that is actual violence against nurses by patients. Well, mostly patients, some via coworkers, but not so much with the coworkers. We'll talk about cases where, you know, nurses are verbally abused, physically abused. You know, there was a statistic, I'm trying to find it, where I think it was in 2018 something like 73% of non-fatal workplace injuries were experienced by nurses, and this actually outranked police officers, and that, to me, that was staggering. You know, you think cops have, you know, the most dangerous job. Well, not always. You know, and two, you know, cops have guns and tasers and batons and handcuffs and all kinds of things, and, you know, bulletproof vests and, you know, things of that nature. Plus, they have a little bit more of a ability to go hands-on much more quickly than we can as nurses. In fact, you know, many hospitals that I've worked at and gone through some of the training, they almost like, you know, no, you cannot put your hands on that patient at all. And, you know, there are some patients, yes, they are sick, yes, they are under your care, but some of them are just plain violent. You know, they're just violent because that's just who they are. It's not because a particular thing is making them violent. In other words, like a common side effect, well, I'll say common, but a potential side effect of steroids is for patients to basically have a psychotic break. And so we give them a steroid, and then the patient, you know, freaks out and starts attacking people. They think that, you know, aliens are coming after them, you know, whatever. That's not the patient's fault, but that still doesn't make me any less injured. It doesn't make me any less hurt, you know. And the things that, what the point to what I'm trying to say is that the tools and things that I have at my discretion are not the same as in other professions, you know, where you could, you know, take that kind of assault and defend yourself from getting further injured. You know, nurses, you know, I've had coworkers that have been permanently disabled because of that. And I'm not talking about, like, you know, their spinal cord severed or something like that. I'm talking about back injuries that no longer allow them to do their job as a nurse, or they've had other injuries that they will never be able to work as a nurse again. You know, and a lot of states don't have the protection in place for nurses, nor do the hospital or the facility. They always err on the side of not injuring the patient. And like I said, whether it's their fault or whether, you know, that's not the point. Like I said, the fact is that if a patient ends up assaulting me, whether it was a medication-induced psychosis or they're just a violent individual, I'm no less injured. You know, you can't go back and fix it and be like, well, you know, it wasn't the patient's fault, you know, that you can no longer walk. You know, not their fault from a legal standpoint, or from a, you know, are they in their right mind standpoint. But again, I'm no less injured. I'm you know, now I have to figure out how I'm going to make a living and probably do extensive rehab, therapy, potential surgeries, things of that nature, potential chronic pain for the rest of my life, all because I was just trying to do my job. One of the other issues, going back to the staffing shortage, so now nurses are taking on more patients. They are expecting us to do more like administrative type tasks. In other words, like ordering supplies and things for the unit or whatever, because maybe we don't have a HUC or a unit secretary or whatever they call them. They've been called different things at different hospitals. And there's a huge gap between leadership and actual frontline workers. Nurses are expected to do a lot more with a lot less. When you are constantly overworked and working above safe limits, it can definitely wear on you. There's statistics of nurses reporting, additional health issues, anxiety, sleep deprivation, them turning to drugs and alcohol and medications for sleep and things of that nature. It's a real problem. Not to mention the fact that it's something that oftentimes just kind of gets swept under the rug. Going back to that lateral violence that I was talking about, less than 20% of any of that ever gets reported. I mean, and that's just horrible. There's fear of repercussions. You're even further ostracized as, seen as not being part of the group, not going with the flow. And I always feel like, when people say like, well, that's how it's been done, that's how it was done for me, and yada yada yada, I feel like that's just a bullshit excuse. If you have to question things, and especially from a moral standpoint, and go, why the hell are we doing this? What is up with this? If we didn't question things, we wouldn't be where we are. We wouldn't have electricity. We'd still not be washing our hands, and just, on and on and on. We wouldn't have vaccinations. So, it's important for nurses to speak up, now more than ever, because this is our livelihood. This is, and not to mention, it's not like you can just, snap your fingers and make a nurse, although, nurses coming from other countries may be very competent, but there's still going to be a learning curve, because there's different medications that we may use that they are not familiar with, different protocols, different procedures. So it's not like you can just, okay, well, we'll just replace them with other nurses. As I said before, the shortage is worldwide. It's not just here in the United States. I think one of the solutions is that states and the federal government need to implement minimum mandated staffing ratios. And what that means is that it's like, hey, if you have a census of 100, then you need at least 13 or 14 nurses. You need so many techs. You need etc. They wouldn't have a doctor try and take care of 200 patients. It just doesn't make sense. Some states have it, and I know, for example, like Oregon has minimum mandated staffing ratios, for sure, in like long-term care facilities. And that's one area, especially in Texas, long-term care is absolutely abysmal It is horrible. You know, I've gone in as a consultant, walked in at, you know, 8, 9 o'clock at night to, you know, maybe do a surprise inspection or monitor a med pass or whatever. And there'll be maybe 3 or 4 LVNs, and maybe you've got 6 or 7 CNAs for 100, 120 patients. I mean, that is just insane. Those people aren't getting good care. They're not being turned properly. They're not being changed. Some of their meds, they're probably not getting them, or at least not getting them on time. And that all of that affects the outcome of their care. So, as I always say, guys, you know, I certainly don't have all the answers, but I definitely think we need to start a conversation. You know, I'm going to, I know one of the things I want to do is reach out to whoever, like my local representative is. We just had an election. I need to figure out all of those things, and I would really like to speak out on some of these topics, and I encourage you guys to do the same. You know, we don't have to stand for this. We need to be safe and feel validated and feel welcome and not feel afraid to come to work, whether it's from fear of getting beat up by a patient, ostracized, certainly not ostracized by coworkers. So yeah, like I said, speak up, guys. Speak up. That's all for this episode. Thank you so much for tuning in. I always appreciate it. You guys are the reason I do this. Please, if you have comments, suggestions, concerns, as always, you know where to leave them. Take care, guys.